Tonight, U.S. health officials are keeping a close eye on the Ebola outbreak in Africa.
More than 670 people have died since the outbreak began in February. And now hospitals in Rhode Island and Massachusetts are training staff to be on the lookout for warning signs.
Eyewitness News anchor Shannon Heggie is live in studio now with more on what you need to know, new at 5:30.
The Centers for Disease Control and Prevention sent a health alert to U.S. doctors this week about the Ebola outbreak in Africa, but maintains the risk of the deadly virus spreading to this country is low. Ebola can look like other illnesses at first. Symptoms include fever, headache, vomiting, and diarrhea. Some patients can later bleed internally and from their eyes and/or mouth. Ebola is spread through close contact with bodily fluids. Health experts say patients are only contagious once they have symptoms. Rhode Island Hospital and Hasbro Children's Hospital, as well as some Boston hospitals, are now telling staff to get travel histories from patients who may have symptoms.
It is possible that somebody could go over there, for example, to help in medical care, become infected, and then come to the United States and become sick here. Fortunately, our doctors in emergency rooms and we infectious disease doctors and public health officials are ready for that.
What we've instituted is that the nurses ask everybody who comes in, every person, about their travel history. And that's very important because if someone comes in and they have a history of traveling to Africa within the past 3 weeks and they have a fever, then that person would be immediately put in an isolation room.
2 American health workers are currently hospitalized with Ebola in Liberia. There's no treatment, but doctors can use therapies to help support the body while it fights off the virus. Ebola can kill up to 90% of victims. I'm Shannon Heggie, Eyewitness News.